Okay, hi everyone. Today I have something so exciting to share with you all. I've got Dr. Natalia Carter here with me. She is a GP or General Practitioner, and she is going to demonstrate to us the equipment that is used in a cervical screening test. So this will just be a short video explaining how it works, what a cervical screening test is, and should hopefully cover some of the basics for you, because I know that getting a cervical screening test is something very scary to think about when you haven't had one done. But in reality, I've had several. They're actually fine. They're nothing to be worried about at all. And I'm hoping, or I'm sure that Dr. Carter will be able to sort of reduce the fear around it. So thank you for being here. Thanks for doing this.
You're welcome. And I do hope I reduced the fear. I think it was scary too. My first one was scary, and I still have women who've had lots of them done who find them scary.
Yes, I mean, fair enough. And especially when you think about it as like, oh, someone's just putting a weird spiky thing up my vagina. Like, that is kind of scary. So
yeah. And it's rather undignified.
Yeah. Maybe perhaps could you start off explaining to us what a cervical screening test is? I think a lot of people will have heard the term pap smear. If you could explain the difference or what the difference in terms is, that would be really, really helpful.
Okay, so there's a part of the body called the cervix, and anything to do with that is cervical.
Yep.
So the cervix gets cancer. It's fairly common, and it's so easily treated that that's a good reason for us to screen to see has anybody got any changes long before they get cancer, so we can do something about it. So we're screening for changes in the cervix before they become cancer, before you get a cancer. So we used to have a test called the pap smear. Now we have HPV testing, and if we need to, a pap smear after that. But the process of getting the sample is exactly the same for the new test as well as for the old pap smear. And the pap smear was really just that it was called a smear because we got a sample and we smeared a microscope slide with the sample, and they looked under the microscope with the guidance, the criteria made up by a man whose name I can't remember, but it started with
Of course it was a man.
Yes. So it became pap smear.
Okay.
And we still call it that because it's been around for so long, but really it's a cervical screening test.
Thank you for explaining that. Okay, so am I right in understanding that for the patient, the procedure is the same, and it's the laboratory testing that is, or the pathological testing that is different?
Yes, perfect. So the test in the labs, well, actually, so the first test in the lab is different, and if needed, then they do the old test as well.
Okay, so they may still smear it onto the little microscope. Okay, yep. Thank you. That is so helpful. And before we start, who should get a cervical screening test? How old should you be? Anyone with the cervix is a good place to start.
Absolutely. Anybody with a cervix, anybody who's had any sexual interaction.
Okay,
so it was whether they wanted to or not.
Okay.
So we need to remember that some people have been abused as children. So even if they haven't chosen to have sex, they still need to have a pap smear. Cervical screening test. We usually say from the age of 25 till 74.
74, that's a specific age. Okay. Yeah. And
it used to be 70, and now that women are living longer, we've extended it for a little bit longer.
Okay, thank you.
And so I need to point out, though, that this screening test is only for people, we call it screening because it's for people with no symptoms. You will still need a test even if you're outside of all of that if you have symptoms, though. So if you have bleeding or pain or something's not right, you may still go through this procedure even though you're younger, older, had one last year, whatever.
Okay. And then you may need to be referred on for further, testing, depending on what it is. Okay, what they find. Thank you.
Yes.
So what are we testing for when we do this test?
Okay. So do you want me to show you the stuff, and maybe that will be easier to explain? Yeah. So like I was saying, what we want to do is get a sample from the cervix. So these, can you see these?
Very well.
These are, yeah, good. So these are 2 brushes we use to basically just go like this on the cervix. And the cervix sort of looks a bit like this. Mm-hmm. And we use 1 brush at a time, just like that quickly, really, like that. And then we put them into this special liquid in the bottle and whooshy, and then that's what gets tested, the liquid in the bottle with the special liquid. Sorry, did I say that right?
I think so.
The bottle with the sample from your cervix gets tested, and what they're testing for is HPV, or human papillomavirus. And they're looking for particular strains. There's lots of numbers of strains, but we know that number 16 and 18 are highly associated with cancer of the cervix.
Okay.
And they also look for others. And if there are others, then we monitor somebody a lot sooner. So if they find 16 or 18, then they will do a smear and then grade the changes that they see on the cells. Depending on the grade of those is to what happens to you next.
Okay, so if you're testing for HPV, human papillomavirus, and by association, we're testing for cervical cancer as well, because those 2 things are so closely linked.
Yes.
Okay.
So we know that HPV 16 and 18 are highly likely to cause cancer, but it does take usually about 10 years to cause cancer.
Okay.
So what we're trying to do is find it very, very early on, and we found that most women's own immune systems get rid of the virus themselves.
Oh, that's handy.
Yeah.
So that's why I'm going to assume that the reason you don't start having cervical screening tests, until you are 25, as opposed to as soon as you become sexually active by your choice, which maybe will be, on average somewhere between the ages of 15 and 18, is because it takes 10 years on average to form regardless. Is that correct? Okay.
Yes. Yes. That's in general. That's just ignoring the very unusual aggressive cancers.
Sure. Okay. There's always outliers. Yeah.
Yes. Yep. So what we're doing is trying to get a sample with these brushes, put it in the liquid, but it's very hard to see a cervix if you just lie there on the bed. Mm-hmm. So that's the part that people don't like, I think, is this thing called a speculum.
Okay.
So
yes, I know her well.
Yeah. So I use a plastic disposable one, and I think it's a little less frightening because it doesn't make so much noise. And the reason we use this is because this goes into the vagina to open the vagina up. If you look into the vagina, you can't see anything. Like if a woman just spreads her legs, you can't see any cervix. So we need to put this in, and I thought I'd show you. It's not that big. I don't know if you can see it. So that's a pen. It's shorter than a pen. And this is the small one that I use. See, it's not much bigger than one finger.
Yeah.
Wide, maybe 2. Yeah.
Less
and if
than
it's
2,
hard to find, and that's the normal size. That's a medium size one, which is bigger but longer. Remember I was saying sometimes you need a longer one?
Yeah.
Yeah. So it's not that big. And if you've been sexually active, you probably put things in that are at least this size.
Yeah. Okay.
So that's why I don't think people should be frightened. So it's really just for putting in, and it opens up to hold the vagina open. So then I can see what I'm looking for, put my brushes in quickly, put it in the liquid, and it's all done.
Right.
And out it comes in. And it should take less than a minute.
Oh, I was about to ask, less than a minute. That's great.
Yes.
And do you usually lubricate the speculum, or you
absolutely.
Okay.
Yes. Yes. Sorry.
That's okay. I think that is something that's less scary. That's also scary for people because they might be, I mean, I would be probably too scared to ask my doctor, can you please lubricate the speculum? That seems like quite an embarrassing thing to ask. But I
No, it's a standard thing that we would do. Yes, standard.
Okay.
But you should also not be frightened to say, I'm scared. Can you do this slowly? That sort of thing.
Right. Okay. Thank you. Yes. Hear that, everyone? Should not be scared. So it's your body. Say what you need to say. Do what you need to do. When you say
especially if you've had an awful experience, this will be quite frightening because you do feel quite vulnerable lying on the bed with somebody coming at your vagina.
Yeah, I mean, yeah, it is a pretty vulnerable position as well. Yeah, and in a clinical hospital or GP setting, usually.
Yes, and if you want, you can always ask to have another person in the room with you. I find a lot of male doctors get a female into the room.
Yes, I used to be the chaperone at my work.
So if you want a chaperone, you ask for one.
So when you say that anybody who's been sexually active should have this done, do you just mean anybody who's had penetrative sex, meaning penis into vagina sex, or is it anyone who's had a sexual experience involving their vagina? So, for example, if they had only had sex with someone who didn't have a penis and they'd had an alternative version of sex, would that be someone who still needs a pap smear as well?
We do encourage women who've had sex with women to also have cervical screening, because until recently, most of us have probably had some interaction with the penis, or with a toy with somebody who's had interaction with a penis.
Okay. So say you're a person with a vagina who's only had sex with someone else with a vagina. You don't know who that other person has had sex with, I guess. So they could have had sex with someone with a penis. So okay. That makes sense.
So it's quite possible that somebody you've been exposed to or shared toys with has also been exposed to HPV.
And can you only get HPV? Is exposure to a penis necessary to get HPV? Is it just any sexual contact? Well, genitalia contact.
Yes, any contact with parts that carry the HPV.
Okay, so vagina, vulva, penis, all of that. Okay, cool. Thank you. Well,
so
not cool. That's bad.
So don't forget, like warts on your finger are HPV, but a different strain.
Oh, I didn't know that. Okay.
Warts on your genitals are HPV, but a different strain, and not the ones we're looking for.
Okay. So if you were diagnosed with genital warts, what we usually consider an STI, don't think that means you'll definitely develop cervical cancer as well.
No.
Okay.
But if you've had one of those strains, is it possible that you've had one of the naughty strains?
Okay.
Serious strains. One of the strains that's going to cause cancer.
Okay. And then I think my other question is, do you still recommend, or personally, do you still recommend people who have had the HPV vaccine to have a cervical screening test? I think that vaccine is often called Gardasil, if anyone's had their Gardasil vaccine.
Yep. Yes, I do. And yes, that is the brand name in Australia, because it only covers it was originally 4 strains. I think the new one coming out covers about 9 strains.
Oh.
So it doesn't mean that it covers every single strain of HPV. Remember I said that 16 and 18 are the most likely to cause cancer, but there are others too.
Right. So when it says, when one is called strain 18, there are strains 1, 2, 3, 4 leading up to that?
Yes.
Right.
Yes,
okay. So the vaccine...
beyond it.
Oh, beyond it as well?
Yeah. I don't know how many there are at present.
Okay. You've explained how the cervical screening test works, which is fantastic. Thank you. And it's great to see that speculum that you would usually use is only the size of, it's less long than a pen.
Yes. And not very wide.
Yes, not very wide. Wider than a pen, but not very wide. What is your practice when somebody's results come back as abnormal, either low risk, high risk, I'm not sure exactly what it would be called, would you call them back in and refer them to a specialist, or what would you do?
Okay, so there are guidelines, very strict algorithm of what you do depending on what the result is.
Okay, so you follow up with the patient and see how
Absolutely.
to respond
so
from there.
Sometimes it's a small change as we just need to repeat it in 1 year instead of 5 years. Or sometimes the change is a higher grade change and then needs to go on to a more sophisticated test.
Okay, yep, thank you. Okay, I think I have 2 more questions. Number 1, how often, say you have no symptoms, but you are someone who has been or is sexually active, how often should you get your pap smear? You'll start at 25 and have it every 5 years?
If you don't, if HPV is not detected, it will be 5 years to the next one. If it's detected, then it depends what the smear shows to whether it's 6 months, 12 months, or a different test altogether.
Okay, that's pretty good. I really like these updated guidelines in Australia. As you'll know, it used to be you start much earlier having your pap smear, and also you have it every 2 years, which is often.
And what ended up happening was we did surgical treatments on a lot of young people who ended up with short cervixes and then trouble carrying a pregnancy because of that. And it turned out if we'd left the women alone, like I said, their bodies would have actually cleared the virus.
That's so interesting. Wow. Well, I mean, I'm glad we know that now. I feel sad for the people who had to go through that, though, for us to get to that conclusion instead of having known that from the beginning. Okay, my other question is, would you be able to briefly just outline again, we covered this in a different video, but I'll be releasing this one first. Would you be able to outline again why some people may need the larger speculum?
Yeah, it's more just about their body shape and size. So sometimes a vagina is a bit longer than others, and just so that we can see and see the cervix, we just need a longer speculum. It just comes wider as well as longer. And sometimes people with a bigger body and larger legs, the vagina sort of collapses a bit down a bit more and just need a bit bigger speculum to hold it open stronger. If you can adjust a woman's position, like get her to make fists and put them under her bottom, it often is all you need to do to move things around and find it quite easily.
Okay, that's what my doctor recommended I do last time I went as well. I know that 5 questions ago I said I only had 2 more questions, but I've just been thinking of more. To clarify, should a cervical screening test hurt?
No.
Okay.
No, it should not hurt. It may not be comfortable, especially if you're anxious, but it shouldn't hurt. And if it hurts, then there's something else that needs looking into. And you can ask to stop straight away and have a discussion about why it hurts.
Okay,
but
that's good.
If toys or penises don't hurt, then the speculum shouldn't hurt.
Okay.
Remember, it's lubricated and small.
Yes. Yeah. Okay, good. Smaller than, like you said, smaller than stuff that you've probably put up there. So that's good. Puts us at ease. And if you're menstruating, so if you're on your period at the time, would you recommend waiting to get your pap smear? Okay. But is that because will it be too unclear? Will the sample
not a good sample?
Okay. Yeah, I've heard that before. And so sometimes I think, please correct me if I'm wrong, I think sometimes if perhaps you have old blood still on your cervix for any reason, or you've got like an ectropion or something like that, the sample might become inadequate and you may have to get the test done again, but that seems quite unlikely.
Yeah, it's much less unlikely now.
Much less likely.
Yes.
Doctors are people too.
It's Sunday night.
Yeah.
It's much less likely since we do the HPV testing.
Okay. That's great. Thank you. I think that truly is everything I planned to cover.
Oh, good.
So thank you for taking the time out of your schedule, especially, as you said, on a Sunday night, to explain this to us and to demonstrate it to us. I hope this really puts people at ease for everybody who watched. I really hope that this shows you that the people, number one, the people performing your pap smears cervical screening tests are normal people and they are nice. They will always use lubricant. You can stop at any time. You can have a chaperone if you need one. It shouldn't hurt, and it's not actually a scary procedure. And trust me, as someone who is scared of things like speculums, I've had several and they're actually not bad. I can guarantee. So thank you, Natalia.
My pleasure.
It's been wonderful having you on.
Anytime, and if you have more questions, just let me know.
Thank you. Have a good rest of your night.
Thank you.